So, okay, so we're going to keep moving on here, keep the pace up. Some really dynamic stuff this afternoon. The next section, guys, is a section that's focused on actually three different companies that are doing a lot, three different technology companies that are largely some of the leading clinical and data analytics technology companies in the direct primary care space. So they've got a unique perspective that they want to share, kind of their experience in the lessons learned and the themes and the things that they think are important for technology being successful in the DPC space. If you're a doctor in DPC, or if you're not a doctor in DPC, one of the things that we certainly recognized early on is that when a physician organization moves to direct primary care from fee-for-service, one of the first things that happens is they usually rip and replace their entire tech stack, because everything that they were using historically in the fee-for-service world is totally irrelevant in this new world. And one of the great things about direct primary care when it comes to technology is that these providers are also completely free to leverage technology any way they can dream up, versus being forced to use technologies that take them down a path that are required to get paid. So there's amazing technology innovation that's happening, and technologies across the healthcare landscape that are starting to come into DPC because they are free to really kind of drive value that they can't in the fee-for-service world. These are some of the companies that are doing that. So with that, I'd like to introduce Vineeth Yeddula, who is the CEO and founder of a company called KPI Ninja. You've heard them referenced today. He'd like to tell his story about what they're doing in DPC.
Good afternoon, everyone. Thank you so much for having me here. So as Zach mentioned, like our weird name. So I want to address, like why we are named KPI Ninja. So as you know, KPI stands for Key Performance Indicators, and Ninja is someone who is specialized in a specific skill or activity. So we wanted to be the ninjas, helping organizations improve key performance indicators. So I want to really give you a quick background about KPI Ninja, what we are doing, and also talk to you about our vision for direct care, working with organizations like Strata Healthcare, Nextra, and also talk to you about a unique platform that we're building called DPC 360, and also give you a glimpse of the future and the direction that we're moving as we progress towards deploying DPC 360 across multiple organizations. So we are a healthcare technology and consulting company, focused primarily on data analytics. And we are a technology company that started in healthcare by healthcare leaders. And this is not something we have started in a different sector and moved into healthcare. So our mission is to improve the health in the communities. So just a brief background about how we got connected to direct primary care. So a couple of years ago, one of our employees was doing research on direct care, and they got into contact with Strata. And we heard about this model. We felt so passionate about supporting Strata Healthcare, and we fell in so much love with that we're actually, as an employer, moving into direct primary care as well. And we are adopting some of the principles like pricing transparency and those kind of things as we build our direct primary care solution. So what's happening right now from a direct primary care standpoint is, as you guys know, there are a lot of stories that are being shared, personalized, convenient. I mean, if you look at the different websites, we did a web scraping of several different websites of direct primary care, and we identified several different themes that are being shared. And as we are starting to build different measures and connect different data elements, our vision around supporting direct care community has started to shape. So our vision is to amplify the stories that are being shared in the DPC community through data. So there are a lot of awesome stories that are being shared, and I know Strata Healthcare, Dr. Besmer did share some of the things that Strata is doing. So this is a quick example, right? I mean, if you look at the top, so like providing affordable, lower medical costs, better health outcomes, convenient and high quality care. I mean, these are some of the stories, some of the themes that are being shared by Strata. But look at the information below. just see the impact that startup was able to make. I mean, just imagine, if you have data, how it can amplify your stories. And that's exactly, what we are trying to accomplish here. So if you look at how we are doing this process, so we have come up with a solution, pretty intuitive. I know I've been demoing the solution for several of you here. So we have started this thing called DPC 360. So the reason why we want to call this as a 360 is because we want to provide like a 360-degree view of what is happening around your practice, organization, and also you can share this with your employers, TPAs, and so on in the future. So basically, we connect with almost any data source that would be of interest to you, and we bring all of that information into our DPC 360 platform, and then you can leverage the insights and the knowledge that is built, and take a look at that at the population level, at the employer level, at the practice level, and at the patient level. So this is a quick snapshot of the Patient 360 platform. So if you take a look at that, right, so it's a bit harder to see here, but to the left, it has some key vital information, and on the right to the top, it has some lab values and stuff. So that's how we can integrate with LabCorp and so on, so we can get that information. And just beneath that, we have virtual visits, claims, all of the information. So we're pulling all of the key data sources and painting a picture from a 360-degree standpoint on what is happening to the patient. So as part of the DPC 360 platform, we are also using technologies like natural language processing. We have already integrated with the patient satisfaction scores company. So we are taking in patient comments and providing a deeper context to what the patients are talking about. So a couple of things I want to highlight in here is the technology that we're using, especially the keyword search, could be, as you can see there, we're just typing the keywords on the top. So that technology could be used even for virtual care. So if you're tagging patients on ED avoids and urgent care avoids, so you can easily search those, add those, and the entire dashboard gets updated. So that's the kind of technology that we're building right now. So I gave you like a really quick glimpse of where we are from a DPC 360 standpoint, but I want to paint you a picture on where we are moving towards. And one of the pain points that we see from a direct care community standpoint is you don't find data analysts, you don't find data scientists in a lot of the practices, so you have to do this by yourself. So from a future looking perspective, what we're doing is we are combining two different technologies. One is search-based analytics, and combining that with voice-based assistance, and delivering a technology that can assist you as you want, and as you want to get deeper information from here. So there's a really quick video, which talks about this technology. And again, you have to deal with my accent just like Zach. So, so if you can play this video. Hey Alexa, ask Ninja.
Ninja bot, what do you want?
Get all HINT patients.
Here are all 472 rows in the HINT_patients table.
What is the average age of HINT patients?
The average of the HINT_patient age column in the HINT_patients table is 26.34.
For each gender, what is the average age of HINT patients?
The average of the HINT_patient age column in the HINT_patients table is 26.88 for the HINT_patients gender female and 25.86 for male.
Get all HINT patients.
Here are all 472 rows in the HINT_patients table.
Plot the pie chart on age.
Here is a pie chart of HINT_patients age.
Plot the link between histogram on age and pie chart on gender.
Here is a linkage between histogram of age and pie chart of gender.
Alexa, clear now.
Your visualization has been cleared.
What do you guys think about that? So this is the future of analytics, right? So where you're not dependent upon a data analyst, a data scientist. So we have several different platforms and several different sectors of industry that we support within healthcare. So we are planning to launch this directly into direct primary care. So that's the kind of power that we want to bring in the hands of the physician, so that we can access information whenever we need this. So we don't have to wait, a week or two or a month, for a data analyst to get information. So wrapping up, can we go to the next slide? So one of the things that we're doing, right now is we are just to give you a taste of the kind of infrastructure that we have built. So we're giving the Hint membership dashboard for free. The process takes just 60 seconds or less to sign up. So we are actually doing a lot of stuff right now, and also doing like natural language processing and search-based analytics. And we would love to partner with you and amplify the stories that we are sharing to the different communities and stakeholders through data. So thank you so much.